Alright, I'm provide privacy. Do my hand hygiene. Might as well put on my gloves right now. Hi, I'm Joseph. I'm gonna be your nurse today. Can you verify your name and date of birth, please?
September 29th, 1984.
And your
LeBron
name?
James.
Thank you. Let me check your wristband. Did you verify that? Alright, thank you. And do you have any allergies that I have to be concerned of?
Nope.
No allergies. Well, today we're gonna do a comprehensive head-to-toe assessment. I'm gonna go through the steps with you, just so if you need me to slow down or have any questions, just let me know. Okay?
Okay.
All right. Perfect. All right. I'm gonna go ahead and have you stand up. Your shoes are removed. Can you stand on the scale for me, James? Thank you. Perfect. 175. And can you stand against that wall for me, back facing that wall, please? Thank you. I'm just gonna do that. All right. 5, 8. All right. You can come back over here. All right. Next, I'm gonna be taking your vital signs real quick. Okay. So I'm gonna check for. I'm gonna put this pulse ox on you. Check your oxygen saturation, and while I do that, I'm gonna count your pulses. Okay. For 30 seconds, I will count your pulses. All right, I got your pulses at 84 and your respiration's at 16. All right, we're gonna go ahead and check your temperature next. I'm gonna go ahead and get my thermometer. Oh, we'll do this in a second. Thermometer. All right, this is your thermometer. We're gonna do it axillary, so just lift up your armpit. Thank you. All right, and you go ahead and close. Beep beep. All right, your temperature is 98.6. Now I'm gonna check your blood pressure real quick. All right. All right. All right. Thank you. 118/79. All right. So now we're gonna go over your head toe assessment, right? I'm gonna start with the head, going all the way down to your toes. Okay. So first, you don't mind if I touch you real quick? I have my gloves on. I'm gonna check your head. Any lesions? Any mites? Any lice? No. All right. Symmetric. No drooping. Touch your neck real quick. Any pain or tenderness?
No.
Perfect. All right, can you do me a favor? Can you look left and right for me? And up and down. All right, now I'm gonna apply some pressure to your shoulders. I don't want you to shrug against that resistance. Perfect. All right, next we're gonna go ahead and check your eyes real quick. All right, if you could just look forward for me. Kim, check for Perla. See, they reacted to the light, yes. They are round and equal. Can you look at the tip of the pen light for me? They are accommodating. All right, perfect. Let's go ahead. I'm gonna pull down on your eye real quick. All right. Conjunctiva is pink and moist. Alrighty. Can we go ahead and, all right, let's look at the gaze. Stare at the tip of my pen light. 3, 5, 6. Perfect. And go ahead and look straight to the wall for me. All right, I'm gonna cover up one eye. Just continue to look forward. Perfect. All right, perfect. All right, let's go ahead and check your ears now. All right. Any pain or tenderness? Is that
No.
palpate? No pain or tenderness? No change. Any pain or tenderness?
Nope.
All right, perfect. All right, let's see your septum. Everything. All right, can you? I'm gonna go ahead and raise your lip. Can you occlude one side for me? Yep. Breathe in and out. Other side for me. Perfect. All right, can you go ahead and open your mouth? Say ah.
Ah.
Perfect. Alrighty. Let's go ahead and check the cheek finger against your cheek. If you can just touch your tongue with my finger. Perfect. Other side. Alright, perfect. Alright. I'm gonna go ahead and have you plug up one of your ears. So plug up one side, and I'm gonna whisper something, right? And I just want you to repeat what I say.
Ethan.
Other side?
Dogs.
Okay, perfect. Alrighty. Let's go ahead and check your sinuses. So you know if there's any pain or tenderness.
No.
No pain or tenderness, perfect. Alright. Alright, now we're gonna go ahead and listen to your respiratory, okay? Oh, and do you have any history of respiratory infection or respiratory disease?
No.
Any difficulties breathing?
No.
No. Have you been exposed to cigarette smoke or any pollutants at all?
Nah.
Perfect. Alright. Alright, I'm gonna go ahead and check your chest. You can go ahead and take off or lift up a little bit. Thank you. Like that. Okay. Alright. I already counted your respirations, but so they should be fine. Let's go ahead and scroll in. Alright. Alright, let's go ahead and palpate. Just breathe normally. Alright, now I'm gonna listen. If you can lay back and have your back face towards me. Thank you. I'm listening to your lung sounds. Oop. Just breathe in and out. 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 Alright, perfect. You can go ahead and sit back up. Alright, and do you have you been exposed to any infectious agents or any history, your parents have any history of hypertension?
No.
Perfect. Alright. Alright, let's go ahead and check for your landmarks. I'm just going to touch it this time, but I will lift up to listen. Alright, go ahead. Can you lift your shirt for me real quick? I'm just going to listen real quick. Thank you. And I'm going to count for a minute. Thank you. So I got 80 beats per minute, and I'm gonna use my bell to listen to for any brewies. All right, thank you. You can put your shit down. All right. All right. Do you get tired whenever you're playing or anything like that with your friends or hanging out?
No.
Do you find it difficult to keep up with them?
No, sir.
All right, perfect. All right, let's go ahead and do your abdominal examination if you lay flat on the bed for me. All right. Real quick question: do you have any experience? Do you have often experience diarrhea or constipation?
No, sir. Any
Any abdominal discomfort?
Nah.
All right, perfect. I'm just gonna lift up and then view your abdomen real quick. All right. Perfect. And go ahead and listen for each quadrant. All right, stay right there. I'm gonna go ahead and palpate real quick. Just let me know if you feel any pain or tenderness. No pain or tenderness?
No.
All right, you can come back up. And are you tolerating your food well?
Yes.
All right, how much do you eat a day? Like you would say, how many meals?
3 meals a day.
All right, perfect. Alrighty. All right, now I'm gonna inspect your arms and your muscles real quick. All right, and check for any. So let me know if you have any discomfort, any tenderness,
No.
and check the temperature. It's warm and dry. All right, if you can repeat after me, can you swing your arms in that circular motion? Thank you. Other way. Thank you. All right, now go ahead and grip my fingers. I want you to grab my fingers and I want you to grip as hard as you can. All right, perfect. You can let go now. All right, now I'm gonna check your pulses for each of your hands. All right, and I'm gonna check your capillary refills and see if you have any clubbing. All right, same thing on this hand. All right, we're gonna check your legs real quick. All right, same thing. Palpate. Just let me know if you feel any pain. Any pain? Any tenderness? Any pain or tenderness?
No.
Okay. Temperature's warm. Everything's dry. You can go ahead and move your legs in a circular motion. And can you do that with your ankles too? Thank you. Can you push your ankles up? Thank you. All right. I'm gonna take off your sock. I'm gonna take off your sock, okay?
Okay.
Okay. I'm gonna check the pulses, okay? Pulse. Cemetery. GPS. Perfect. And then capillary refills. Perfect. Can you go ahead and put the socks down? I'm just gonna document everything real quick. Oh, can you put your socks back on for me?
Okay.
I'll help you with this side. Okay. All right. Perfect. Can you go ahead and stand up for me? And I want you to go ahead and bend forward and touch your toes. All right. Nice glutes. Any pain or tenderness as I'm touching?
No.
All right, perfect. I want you to stand up normally, and I want you to walk away from me and come back. Perfect. And I want you to hop on one toe, alternating forward. Yep. Perfect. All Alright, now I want you to put your feet together and arms to the side. Stand forward a little bit. Yep. And now I want you to close your eyes. So we're going to do this for 30 seconds. You're not losing any balance?
No.
Don't feel anything? Perfect. Alright, go ahead and open your eyes. Now I want you to walk heel to toe. Just to check your balance real quick. Now I want you to come back and walk on your heels. Yep, just on your heels. Yes, sir. Alright, now go back and walk on your toes for me. Alright, and a few quick questions for you and your parents. Do you have any history of seizure activities?
No.
Perfect. And any learning deficits or any family history of seizures?
No.
Alright, perfect. Alrighty. Alright. Oh, next I'm going to check your upper extremity coordination and your lower extremity coordination, right? I want you to go ahead and pat your thighs, but alternating in and out. Yeah, palm in and palm out. Thank you. And now go ahead and stand on one foot and touch your shin with it. Rub your shin, and then same thing with the other. Now, stand normally. Yep. All right, and go ahead and sit down for me real quick. And that should conclude the head to toe assessment. I'm just going to document all the findings, and then your doctor should be in here shortly. Thank you.
Thank you.
And hygiene, privacy.